But what exactly is the voice, and what happens when the voice becomes paralyzed? The American Speech, Language, and Hearing Association, ASHA, describes voice and vocal fold paralysis as the following. Everyone has two vocal cords in his or her larynx, or voice box. The vocal cords vibrate during speech to produce voice. If one or both vocal cords are unable to move, then the person will experience voice problems, and possibly breathing and swallowing problems. This is vocal cord paralysis.
Paralysis of the vocal cord or vocal folds can occur for a variety of reasons. This can result from an illness, intubation, surgery, a stroke, or sometimes just for no real reason at all. Patients who have a vocal fold paralysis can experience hoarseness or breathiness of the voice, difficulty with swallowing, especially with liquids, and shortness of breath, especially with speaking. Difficulty with swallowing is probably the most worrisome symptom and should be evaluated promptly because of the risk of aspiration and pneumonia.
According to the American Speech, Language, and Hearing Association, unilateral vocal fold paralysis is when only one side or one vocal fold is paralyzed or has a very limited movement. It is more common than bilateral paralysis, which means both of the vocal folds are paralyzed. Symptoms of unilateral involvement often include inability of the vocal fold to move at all, running out of air easily, and inability to speak clearly or loudly. As mentioned previously, bilateral vocal fold paralysis involves both vocal cords becoming stuck halfway between open and closed, and not moving either way. This condition often requires a tracheotomy, or an opening made in the neck to provide an airway, to protect the airway when the person is swallowing.
Preliminary battery of tests we've conducted and the visualization of your larynx, we have come to the conclusion that you do have unilateral vocal fold paralysis.
And what are my options, doctor?
The first option would be an injection, which adds bulk to the vocal folds to make them meet at the midline. The substances that are currently in use are collagen, silicone, and also body fat. And if we do decide to go that route, we can choose together which substance you would like to use.
Aside from injection, another surgical option is medialization thyroplasty. During this procedure, a window is created in the anterior mid-portion of the thyroid cartilage, which supports the implantation of a shim. This changes the overall shape of the trachea and brings the vocal folds closer together. A surgical procedure called a tracheostomy may be performed in individuals with bilateral paralysis to aid in breathing. In a tracheostomy, an incision is made in the front of the patient's neck, and a breathing tube is inserted through a hole, called a stoma, into the trachea. Behavioral interventions may involve exercises to strengthen vocal fold movement, postural changes such as a neck turn to position the vocal folds more closely together, or the use of a voice amplifier to increase loudness without inducing strain. Swallowing techniques are also commonly taught, as demonstrated in the following scene.
I'd like to try a swallowing technique. Hold your breath, and then swallow, and then I would like you to cough right before breathing again. I'll try first. Now you try. Good.
Even after the initial event of being paralyzed, the vocal fold may regain movement up to 1 year after injury. Using laryngeal electromyography, LEMG, can help predict whether or not the vocal fold will regain function, and these are used to plan for surgical intervention if necessary. Both medical and behavioral interventions can result in an excellent prognosis for the patient.
So if you were to recommend to family members sort of do's and don'ts, things that will help their family member in terms of communicating. One is to recommend, if they're talking with their family member who has the vocal fold paralysis, it will be important to talk to them face to face, making sure that they are looking at the person that is talking to them. Another thing will be to eliminate background noise. So turn off TVs and radios, eliminate background noise. We discourage multiple people talking at once, so one person talking at a time, so the person with the vocal fold paralysis doesn't have to talk over other people talking and noise. And also we encourage family members to observe therapy and also to encourage and reinforce the voice techniques that we may be teaching in therapy. The most important thing is to talk with family members, significant others, about being patient with the individual. They certainly know what they want to say, they have the words, it's just their ability to execute it is now changed, and we need to support them and help them to adapt to the new techniques they need to use, the new habits they need to